Hello, I'm Urologist Erdem Akkaya. Today, we will have a short video presentation about what tests we should do before testosterone treatment, what we should pay attention to. We can divide the tests before testosterone treatment into three. One is a blood test. One of them is the sperm test and one of them can be considered as a blood pressure measurement. If we evaluate blood pressure measurement and the sperm test, as you know, testosterone can cause hypertension in the body after taking it. It must be evaluated whether the person's blood pressure is already high or not. At the same time, I think if the patient is in reproductive age, if they are thinking of having a child, and if they will receive testosterone treatment in the future, a sperm test must be done. Because there may be a defect, inactivity, a decrease in the number or concentration of the sperm. In such a case, the structure of testosterone therapy can be changed. Treatment can be provided in a way that does not damage the testicles. Because many patients come to us every day in the fact that this patient has a normal hormone profile, normal testicular volume, normal physical examinations, and normal sexual powers does not mean that these patients are not infertile. So this can only be understood by doing a sperm test. We can divide the blood test into two, biochemical tests and hormone tests. What do we check for in biochemical tests? In biochemical tests, kidney function test, liver test. These should definitely be checked. Apart from that, it is necessary to look at the cholesterol panel such as LDL, triglyceride, total cholesterol, which we call the cholesterol profile. Because again, testosterone affects the cholesterol profile badly. While increasing LDL, it decreases HDL. At the same time, it is necessary to look at hemogram. Why is hemogram important? In testosterone treatment, we know that the blood gets darker, that is, what we call hyperviscosity, and its density will increase. If the hemogram is over 18 and the hematocrit is above critical levels, it may be risky to take testosterone therapy. Because it increases blood clotting and can cause blockage in the arteries. Therefore, it is absolutely necessary to check the hemogram, that is, the complete blood count, in the initial phase. Hormones must be checked. What do we check for in hormones? Total and free testosterone is checked, estradiol E2 is checked, and sex hormone binding globulin is checked. Apart from that, FSH, LH is checked, prolactin is checked, and PSA is checked. If the person is over 40 years old and will use testosterone, I think the PSA of the patient must be checked. PSA is our prostate cancer tumor marker. Why do we check this? Normally, testosterone does not cause prostate cancer, but it can accelerate the growth of an existing tumor. We expect an increase in PSA when we use testosterone, but at least we monitor it, we measure its level. We can see if it has reached critical levels. It must be checked at the beginning. If we look at hormones here, FSH and LH. FSH provides sperm production and LH provides testosterone production. Apart from that, we have already talked about free and total testosterone many times before. I want to elaborate on sex hormone binding globulin. What does sex hormone binding globulin mean? It is a hormone that enables sex hormones to be transported smoothly and stably in the blood to tissues and organs. And also enables sex hormones to passivate when bound to this protein, and is particularly critical for testosterone. Why is it critical? Because almost half of total testosterone is bound to sex hormone binding globulin. Once testosterone is bound, it becomes passive. Only after getting rid of sex hormone binding globulin, testosterone can play an active role in tissues. It can also bind estrogen with sex hormone binding globulin. Low sex hormone binding globulin can cause the person to be more affected by estrogen, and when it is low, we can change the ranges of testosterone in testosterone replacement therapy. Again, when it is low, the person loses more testosterone than urine. You can read many articles on how to lower sex hormone binding globulin. Frankly, when foods such as estrogen or xenoestrogen, phytoestrogens are taken to reduce it with food, that is, when estrogen-increasing foods are taken, it is said to be particularly affected by green tea. Sex hormone binding globulin increases due to the increase in estrogen and then testosterone decreases. Apart from that, sex hormone binding globulin can increase again in thyroid treatments. What decreases it? All androgens decrease it. For example, Proviron, or Winstrol, especially Winstrol, can decrease sex hormone binding globulin in half even after 3 days of use. Sex hormone binding globulin can be affected by IGF-1, calorie-restrictive diet or carbohydrate-restrictive diet. Actually, there are many factors that affect it. But the most important strategy for lowering sex hormone binding globulin may be estrogen-based treatment strategies. Especially the treatment strategies for estrogen reduction, which are losing weight, exercising. These are again testosterone-boosting treatments. If these are done, sex hormone binding globulin may decrease. Other than that, these are the general tests. Thank you for listening, best regards.